Ladies and gentlemen, welcome to the National Diabetes Month Tools for Your Patients conference call. Your host for today is Andrea Boucher. Ms. Boucher, you may now begin.
Thank you, and good afternoon, everyone, or good morning to you, depending on where you're joining us from. And thank you for joining us for today's webinar on National Diabetes Month, What Can You Do for Your Patients? This is presented by the Lake Superior Quality Innovation Network. Lake Superior Quinn is comprised of three organizations, which is MPRO in Michigan, Medistar in Wisconsin, and Stratus Health in Minnesota, to support the Centers for Medicare and Medicaid Services priorities for healthcare quality improvement in each organization's respective state. Again, my name is Andrea Boucher, and I am a Senior Clinical Quality Consultant at MPRO here in Michigan, and I work on our diabetes and cardiac projects. I just have a few housekeeping items before we begin. I just wanted to let everyone know that today's webinar slides will be available on our Lake Superior Quinn YouTube page within the next week. At the end of our presentation today, there will be an evaluation that we would like all participants to complete in order to provide us feedback on how we did and how we can improve our work in the future. So we would greatly appreciate your feedback and your comments. If you do have questions throughout the presentation, please feel free to enter them into the chat and we will get to them at the end, or feel free to dial in at the end of the presentation. So with that, we will go ahead and get started. All right, so I just wanted to review today's objectives. We are going to go through the National Diabetes Education Program's guiding principles. These were created to bring together existing guidelines to help primary care providers and healthcare teams to deliver quality care to adults who either have diabetes or are at risk for diabetes. And we're also going to look at resources that are available to primary care practices to improve the care for patients with diabetes or prediabetes. So for each of the guiding principles that we go through today, we will provide resources that are available to primary care physicians that can be utilized. All right, so in case you were not aware, November is actually National Diabetes Month. It is observed every November, so individuals, healthcare professionals, organizations, and communities across the country can really bring attention to diabetes and its impact that it has on the millions of Americans that it affects. So this year, the National Diabetes Education Program theme for the month is Managing Diabetes. It's not easy, but it's worth it. So this theme really highlights the importance of managing diabetes to prevent any diabetes-related health problems that can include heart attack, stroke, kidney disease, vision loss, and amputation. So this theme also serves as a reminder to people who may be struggling with the demands of managing diabetes that they're not alone in this and that there is help out there. Diabetes Month is a great time for primary care providers to reach out to their patients, especially if they feel their patients are having trouble coping with the day-to-day management of their diabetes. NDEP has a lot of really great tools and materials for patients with diabetes, as well as family and friends and healthcare teams as well. So the large health and financial impact of diabetes and the existing gap in achievement of the treatment and prevention goals poses a really great challenge in our healthcare system today. Today there's more than 29 million people, which actually equals out to about 9% of the U.S. population that has diabetes. So there's actually another 86 million Americans aged 20 and older who have prediabetes or are at high risk for developing type 2 diabetes and heart disease. So that actually equals 1 in 3 Americans that either has or is at risk for diabetes. So like I said, the financial impact is significant. The total estimated cost of diagnosed diabetes in 2012 was $245 billion, including the $176 billion in direct medical costs and $59 billion in reduced productivity. So with all of these impacts, healthcare teams are inundated with multiple guidelines to follow for prevention and management of illness and complications related to diabetes. And that can be overwhelming even to the most dedicated healthcare professional. So what this webinar is for is to really provide you a comprehensive resource to what's out there and what's available for you. Healthcare reform requires a coordinated approach to chronic illness to improve outcomes and reduce costs, and this is why we must address ongoing diabetes primary prevention efforts to promote the benefits of therapy to delay or prevent the disease. So the National Diabetes Education Program formed a writing group that updated the guiding principles to help healthcare team members provide evidence-based care for those patients who either have or are at risk for diabetes. So these principles touch on a few things. They emphasize areas of agreement among existing practice guidelines. So like I said, this webinar will serve as more of a comprehensive review of what is available out there for primary care practitioners. It outlines 10 science-based principles of care that are the cornerstone of diabetes prevention and management, and we'll go through each of these individually. And it also provides healthcare teams with clinically useful resources to improve care and key references to major research findings. So again, these guiding principles are not guidelines for diabetes care, but they clarify any areas of general agreement across the currently existing guidelines that are out there. So the first principle is to identify people with undiagnosed diabetes and prediabetes. And this principle provides an overview of why it's important for healthcare teams to test for prediabetes and diabetes. It also highlights who should be tested and the parameters for diagnostic testing. So like I said, detecting patients with diabetes or prediabetes is essential for identification, as these individuals can benefit from the evidence-based therapies that are available for them that can alleviate their risk for progression to diabetes, and it can also help to modify their risk. So the CDC and the American Medical Association have put together a toolkit. It's called the Prevent Diabetes Stat, or Screen, Test, and Act Today, the Prevent Diabetes Stat Toolkit, to assist with this. So this is where this image on this slide, the MAP framework, comes into play. It stands for Measure, Act, and Partner, and that's included in that toolkit. It outlines multiple ways that patients can be identified as at risk or if they do have prediabetes. So identification of those patients who have prediabetes can be done in two ways. It can be either at the point of care or retrospectively. So the point of care method assesses risk for prediabetes during a routine office visit. So a provider would test and evaluate a patient's blood glucose level based on their risk status. And then the second method, which is the retrospective analysis, is where you would query your electronic health record to identify patients with a specific BMI, typically anything that's over 24. And if the patient is Asian, it would be anything over 22. And you'd also look at blood glucose levels that are in the prediabetes range, so anything that's classified between 5.7 and 6.4 for an A1C level. So the MAP framework shown on this slide, along with the toolkit, can be used to screen and identify patients for prediabetes. It also helps with referring patients to diabetes prevention programs and also creating feedback loops, linking the patient's progress in the diabetes prevention program back to the physician practice. All right, Principle 2 explains that the progression to type 2 diabetes among people who have prediabetes is not inevitable. We suggest that modest, sustained weight loss or metformin therapy in any at-risk individuals can prevent or delay the onset of type 2 diabetes, and that's what Principle 2 reviews in these prevention approaches. So one resource that is really great for patients that have a prediabetes diagnosis is the CDC's National Diabetes Prevention Program, also called DPP. It has a lot of great steps to prevent or delay the onset of type 2 diabetes. So helping patients to understand the reasoning behind that and the importance of prevention is really the first step to the patient being a successful self-manager in their own care. So oftentimes, the initial stages could be asymptomatic, And especially for patients who will only visit the doctor when they're sick, it's really important to explain what the benefits are of wellness visits and making their health a priority in their life. So lifestyle interventions like the DPP program that's shown on this slide can really cut a patient's risk for type 2 diabetes in half. And principle 3 is to provide ongoing self-management education and support for people with or at risk for diabetes and its complications. Effective self-management education and ongoing self-management support are really important to allow people who are at risk for diabetes to make informed decisions and to assume the responsibility for the day-to-day management of their disease. So principle 3 just gives you an overview of what diabetes self-management is. It talks about how healthcare teams can provide self-management education and support, and also information about services for people who are at risk. So diabetes self-management education, also referred to as DSME, it's an ongoing process that helps to facilitate a person's knowledge, skills, and ability for self-care. And the process incorporates every patient's needs, what their goals are in relation to their care, and also what life experiences they have, what their current situation is in dealing with diabetes. And it's really guided by evidence-based standards. So the objectives to DSME are to support informed and shared decision-making. It encourages patients to be more actively involved in their own care, to develop self-care behaviors. It helps patients with problem solving and critical thinking, and also forms an active collaboration between the patient and their healthcare team. So this will help improve the patient's clinical outcomes, their health status, and also just their quality of life in general. So what this slide shows is the 4 critical times to refer to DSME. So the first one is with a new diagnosis of type 2 diabetes. So right when a patient becomes diagnosed, it's really critical that they receive this education. That would be the first time to refer a patient. Secondly, you want to refer them annually for health maintenance and prevention of complications. So if it's believed that a patient needs a review of their knowledge and skills related to diabetes, or if they've had diabetes for a long time and have had limited education related to it, that would be a good time to refer. The third would be when new complicating factors that influence self-management happen. So, for example, if there's a change in their health condition, or they now have a certain physical limitation or emotional factors, that would be the third point that you would refer to DSME. And lastly, when transitions in care occur, so this would be if a patient's living situation has changed, or if there's a change in the patient's medical team or their insurance. So those are the 4 critical times to refer to DSME, and that's what's shown on this slide. Also, in addition to diabetes self-management education, there are also community-based workshops available to your patients. So these are the Diabetes Path, is what it's referred to in Michigan, which is the Stanford Diabetes Self-Management Program. Or there's also DEEP workshops if you're joining us from Minnesota or Wisconsin. So research shows that patients who take part in these types of workshops can significantly reduce their complications, like, for example, lower extremity amputations. They can improve their clinical outcomes and quality of life, and also lower their A1C levels, lose weight, and learn healthy coping skills. So as healthcare providers, there's multiple options to refer to a community-based workshop. It can either be done, like I said, by referral and making patients aware of these offerings, or even hosting a workshop in your own office. So here in Michigan, we've hosted multiple workshops in provider offices, and we've received a lot of positive feedback. Some examples were that, to quote one of the providers that we have done this for, is that the workshop was able to provide information to patients that the provider did not always have the time to do. So in a comprehensive and relaxed setting, the program was able to communicate encompassing information that persons with diabetes need, such as diet, self-monitoring, and exercise. The patients loved it, and the staff enjoyed seeing their patients so engaged. And for physicians thinking about hosting a class, it's really simple to identify the patients, easy to set up, and the patients love it. And this particular physician said that she's already compiling a list of patients for another workshop in the spring. So we've had a lot of really great feedback, and there's multiple ways that this resource could become available for your patients. Principle 4 is providing individualized nutrition therapy for people with or at risk for diabetes. Individualized nutrition therapy is a really important part of diabetes and prediabetes management. So this principle looks at the role of nutrition therapy providers such as dietitians, looks at macronutrient recommendations, and it also talks about helpful behaviors for weight management and the different coverage options for nutrition-related services available to patients. So helping patients understand what does and does not affect their blood glucose levels helps them to become and take better control of their diet and give them a sense of empowerment over their disease. Medical nutrition therapy is a resource available to patients that providers can refer to. It talks about therapeutic approaches to treating medical conditions and their associated symptoms, and also discusses tailored diets devised and monitored by a registered dietitian. So again, it's a chance for a provider to refer a patient to a registered dietitian to talk about what they eat and what their eating habits are, to provide a thorough review of their nutritional plan, and to develop a personalized nutrition plan for that patient. So again, another great resource that is available to your patient. For people with or at risk for diabetes, regular physical activity helps to improve insulin sensitivity and glycemic control. So this principle, number 5, focuses on the different types of physical activity that patients can engage in to reduce their risk of developing type 2 diabetes and how to better manage it. It also explains goal-setting techniques and appropriate precautions to consider when developing a physical activity plan. So this resource that is shown on this slide is from the National Institute on Aging, and it gives some exercise and physical activity tips to help people become more active. So this is a great tool to use, a great handout for patients. It really encourages participation and helps them to be self-motivated to be physically active. It'll be important to keep an integral part of each person's daily routine. So physical activity along with the nutrition therapy that I discussed on the previous slide are both key components of the lifestyle interventions that were tested in the DPP program for prediabetes. That was part of principle number 2. And principle 6 addresses the importance of controlling blood glucose to prevent diabetes complications. So this principle talks about the risks and benefits of blood glucose control, and also consideration for what blood glucose treatment goals should be at, the management and assessment of blood glucose levels. So poor blood glucose is defined as anything with an A1C that is above a 9, and that's associated with symptoms that can include frequent urination, thirst, blurred vision, fatigue, and also recurring infections. So treatment of adults with type 2 diabetes who do have poor glucose control is really important that they lower their A1C to about 7.5. And that's been shown to significantly improve their quality of life and their work productivity. So beyond relief of immediate symptoms associated with poor control, the goal of blood glucose control is to reduce the long-term complications of diabetes. So any issues a patient may have with amputations or eye disease, things like that. So for your patients who do have diabetes, it's recommended that they self-monitor their blood glucose, which is also referred to as SMBG. Any patient who is using insulin should perform SMBG. If they are doing injections of insulin multiple times a day, or if they're on an insulin pump, the SMBG should be performed at least 3 times a day. So the decision as to whether and how to prescribe SMBG in non-insulin treated patients should be individualized, so based on that specific patient. I would encourage you to consider SMBG when it's needed. So when medication therapy is initiated is a good time to initiate SMBG, or if it's medication therapy is changed, or if patients have any indication that their diabetes control is not stable. So if a patient has had a recent history of hypoglycemia, or also medically complex patients. So it's recommended to prescribe the SMBG schedule to collect the information needed to adjust a patient's meal plan and medications, and particularly looking at insulin here. So you would want to instruct patients clearly as to when and how to check their blood glucose and what to do with their results. Because if they're just checking their glucose just to check it and they're not doing anything with the results, or they don't know what they mean, that's really not doing the patient any good. So it's really important to encourage the patients to understand what their readings mean and to know what to do with them. You want to review the SMBG data and the patient's A1C results with them at every diabetes visit, and also take them into consideration when making any therapeutic management decisions. So people with diabetes perform SMBG as a tool to help improve glycemic control. So patients who do understand what their readings mean are really utilizing this as a tool to get their blood sugar under control. So since SMBG, it can be expensive and really burdensome for some patients, a lot of research has actually been conducted to see if this is really effective and it's worth the cost, and also the inconvenience to the patient to be, pricking their finger every day. So really to understand what the effectiveness is to SMBG. The result of these research findings have really come to a general agreement that SMBG should be recommended for all insulin-treated patients. It's a little less clear as to how effective it is for patients who are on oral medications, or if they're just managing their diabetes with diet and exercise lifestyle changes alone. But for the patients who are using SMBG, they really need hands-on instruction on how to use their glucose meter, especially with quality control of the meter. So training is really more effective when patients are asked to demonstrate the correct procedure as opposed to just listening. It's really good to use the TTRAC method for them to demonstrate how to properly use the glucose meter. And principle 7, with that, you want reducing cardiovascular disease risk is a really high priority for patients who have diabetes or prediabetes. Principle 7 focuses on providing blood pressure and cholesterol screening and control, smoking cessation, and other therapies to reduce cardiovascular risk. And it also discusses the management of CVD risk factors, including the effectiveness of treatment for hypertension, the use of statin therapy and antiplatelet therapy, and also tobacco cessation. So for this principle, I want to specifically focus on the blood pressure control. The Million Hearts Initiative has a protocol that's available to practices that outlines controlling hypertension in adults, and that's the protocol that's on the screen. It's a customizable tool that can be used to manage patients with hypertension, and it actually outlines various treatment options based on what the patient's blood pressure threshold is. So this tool can be customized based on what the practice wants their thresholds to be, but it just gives recommendations on treatment therapies, lifestyle modifications, just so that all providers in the practice are on the same page and providing the same kind of care to their patients. Principle 8 is to provide regular assessments and detect or monitor diabetes microvascular complications and also treatment to slow their progression. So for patients who have poorly controlled diabetes, this can lead to microvascular complications such as neuropathy and retinopathy. And this principle focuses on how to assess those complications and what is available to really slow their progression. Some resources specifically related to neuropathy is on the 3-minute foot exam. So this exam actually meets the screening needs of patients who have diabetes. And the exam that's described in the infographic here is a time-sensitive tool that can be used by a wide variety of clinical professionals to meet that screening need of diabetic patients. And it outlines the steps to take, which starts with asking, looking, and teaching. So first, you want to ask the patient about their history. Here you would discuss any symptoms they may have, whether they have had a previous podiatric care or previous foot exam with a podiatrist. Secondly, you want to look. So this is looking for any signs of infection, checking the patient's range of motion in their feet, and also completing a touch test. And then lastly, you want to teach the patient about recommendations for daily foot care that they can use, talk about proper shoes that they should be wearing, and also just talking about overall health. So an example for that would be providing smoking cessation to the patient if they are a smoker. So some populations require special considerations for the management of their diabetes, and Principle 9 highlights the importance of tailoring care to the needs of these groups. And for this particular webinar and the resources that we're going to provide to you, we want to focus on the group of older adults. Obviously, there are other groups that take special consideration. That includes children, women of childbearing age, again, older adults, and then high-risk racial and ethnic groups. Older adults are at high risk for both type 2 and prediabetes, and data has actually shown that half of older adults actually have prediabetes. So this resource, put together by the American Diabetes Association, provides information to help older adults manage their diabetes and prevent or delay related health problems. So it also includes a special section for caregivers, which obviously with the group of older adults, there are going to be probably more caregivers involved with the management of their diabetes, and it gives them tips on giving support to their loved ones. And lastly, Principle 10 is to provide patient-centered diabetes care. So patient-centered care can be defined as providing care that is respectful and also responsive to individual patient preferences, needs, and values, and also ensuring that patient values guide all of your clinical decisions. So this principle addresses the importance of patient-centered diabetes care and the management of diabetes. So some examples of that can include consideration of health literacy and numeracy, also comorbid conditions that involve team care coordination. So we see that a lot with patients with diabetes, typically always do have a comorbid condition, so it's really important to manage all of their conditions together. Other things to consider include language barriers and other cultural considerations to ensure that the right information is getting across in the best way. So we've gone through each of these principles, and I've shown you different resources available related to each. So now I want to focus on what this means for the patient with 3 key messages that a provider can relay to them. So the first key message, number 1, is that diabetes is a serious disease that require self-management education and support as early as possible to prevent diabetes-related health problems in the future. So, I talked about this a lot already, but research has shown that if a patient is able to manage their diabetes as early as possible, that can prevent diabetes-related health problems that include kidney disease, vision loss, heart disease, and stroke. So managing diabetes is like a balancing act for a lot of patients. Their self-management behaviors can include maintaining a healthy weight, being physically active, making healthy food choices, taking medications as their physician has prescribed to them. So a patient having access to diabetes self-management education can really improve their quality of life, help them to increase their healthy coping skills, and also decrease the diabetes-related distress. Because with the day-to-day management of diabetes, that can definitely add a lot of stress in a patient's life. So it's definitely really helpful for patients to receive diabetes self-management education and support. The key message number 2 is that managing diabetes is not easy. Having a plan and setting goals can help you take small steps to stay healthy. So, like I said, many people struggle with the day-to-day management of diabetes, and it's really important here for a provider to emphasize that patient is not alone. Making changes in how the patient cares for themselves is really all a matter of trying and learning and really understanding what works best for them. So we want to emphasize here that the patient doesn't necessarily have to make huge lifestyle changes all at once. It's important here to set realistic goals based on what is important to them. So it's important to encourage small changes. Some examples of that could be walking for 15 minutes a couple times a day, or maybe replacing sugary drinks with water. So those are small changes that can really go a long way for the patient, especially in managing their diabetes. And key message number 3 is managing diabetes is a team effort that requires participation from you, your family members, your healthcare team, and other networks of support. So like I said, diabetes can be very overwhelming. It is a hard disease to manage alone. So here we want to emphasize that the patient is the most important member of their healthcare team. So encourage them to learn as much as they can about their disease and to talk with their diabetes care team and how they can best care for the patient's diabetes to stay healthy. Also, encourage your patients to ask for help. If they're having trouble coping with the demand, it's okay to ask for help. Again, the patients are not alone in this, and having that network of support of family and friends and the healthcare team can really help the patient stay on track with their diabetes care plan. So one last thing I want you to consider is that people with chronic conditions rarely spend more than 1% of their life at a healthcare facility. It's the other 99% of one's life when an individual is at home that determines whether they return to full health or not. So as I read this statement, all of us know how true that really is. So people with diabetes or other chronic conditions spend the majority of their time in the self-management portion of their disease. So that's when they're interacting with family, friends, caregivers, or just spending time on their own. So this is where it's really important to develop the consistent and evidence-based self-management skills, and that way persons with chronic conditions or diabetes can really maintain their health, also reduce any risks or avoid complications from their disease, and they can really just lead the life that they want to live. So this is where proactive self-management can be a really important determinant in a person's ability to live longer and to also be more healthful. So again, patients spend so much time on their own in self-management. It's really important to give them the tools they need to be able to be active self-managers in their care. All right. This slide just shows you all of the resources that were discussed for each of the guiding principles. The slides should be available for you after this presentation, so you will be able to access all of the links that are available in this PowerPoint presentation. And my contact information is on the screen. So I don't see any questions in the chat, but at this time, Natasha, can we open the line for questions?
Ladies and gentlemen, if you would like to ask a question, please press 1 on your telephone keypad at this time. Once again, if you have any questions, please press 1 on your telephone keypad. And we're waiting for callers to join the queue.
And while we're waiting, if you would rather enter a question in the chat or the Q&A section, please feel free to do that. Or if you'd like to reach out to me individually, my email and phone number are on the screen.
There are no callers in queue at this time.
Okay. So again, as I mentioned at the beginning of today's presentation, our slides are going to be available on the Lake Superior Quinn YouTube page within about the next week. At this time, we've pulled up the evaluation questions, so I just ask that you please take a moment to fill these out to let us know how we did. And if there are no questions, that is all I have for you today. So thank you for joining us, and I hope everyone has a great rest of their week.
Ladies and gentlemen, this concludes your call. You may all disconnect at this time.